Greetings. Today I'm going to talk about medical record coding, mainly for hospitals, physicians who work in hospitals, but really for physicians in general. Here's a reality that a lot of people don't know. Physicians are bad at coding. Not necessarily procedure coding, although some of them are bad at that as well, but they're actually kind of bad at diagnosis coding. Why? Truthfully, I don't know why. They go to medical school. I think they spend a lot more time on learning how to diagnose things as far as patients go, and then, along that area, rather than actually understanding how the coding works. And I'm going to talk about two things, and both of them involve me. One of them does not involve me as an inpatient, but it involves inpatient coding, and the other one involves me as a patient when I had an outpatient procedure done many years ago. So I had an appointment with my podiatrist, and I was sitting there in the chair with him, and he was doing some stuff with my feet. And he said, by the way, you know that the COVID numbers aren't true. And I said, what do you mean? He said, well, they're saying that at the time, they're saying over 500,000 people have passed away. None of that is true. He said, it's probably close to 200 to 300 people. And I said, really? Where did you get that from? He says, well, the truth is that all the people who have passed away, almost all of them, had something already wrong with them. And that's what killed them. It had nothing to do with COVID. Now, because I'm sitting in the chair, he's doing some stuff with my feet. I wasn't taking any chance on telling him he was wrong and why he was wrong. I just kind of let it go at the time. But he's not alone. There are a lot of physicians. Luckily, they're not the majority, but there's a lot of physicians who are going around telling people that the COVID death numbers have been made up because people have had other things that were wrong with them, that it had nothing to do with COVID. Here is an explanation. This is just how coding works in the medical field. If you had asthma and you go into the hospital and they get you on a respirator or ventilator, whatever, and you don't survive that, then all you had was asthma. That's what you passed away from. That was your underlying condition. That's how that works. However, if you go in because you had the flu, but you also had asthma, and you don't survive, then it's the flu that made you die. Yes, you had an underlying condition, but it was the flu. That's the exact same thing with COVID. If you have different issues, you have these medical issues, and COVID gets in there, COVID is the bad boy. COVID came in and said, okay, you know what, step aside, let me finish this off. Sometimes you survive, but a lot of times you don't. And that's how come we're over 600,000 people who have passed away now. It's because of COVID. And when you code that, you code COVID as the bad boy. COVID is the number one reason that person passed. They didn't pass away because of anything else that they had. That's how it works in healthcare. That's how hospitals code things. And by the way, for those who have survived, they need to be lucky that it's coded that way, because there's a lot of states, I'm not sure if it's federal funds or state funds, but a lot of that has been covered by government. My next door neighbor had COVID. She was in the hospital for 6 days. 3 of those days on a ventilator, but she's in the hospital for 6 days. And she didn't end up paying for any of that because COVID was the number one diagnosis. And that's how it works. So if you're hearing any of these physicians saying that's not true, it is true. They just don't know how coding works. Now, my personal story is that back in 1997, I had to have a breast operation because I had a lump in my breast and it was painful. And the doctor's office called me a couple of times, said, we're having trouble getting the insurance company to authorize the surgery. I said, why? He said, well, they're not really telling us. I said, okay, let me talk to them. Since this is what I do, I called up Blue Cross and I got someone on the phone who I talked to before, and I said, okay, we're having this problem here. I have to have this surgery. I've got this lump in my breast, and I need to know how come you keep denying the authorization for it. And she says to me, well, we see that kind of thing as, oh Lord, we don't see it as necessary. We think it's what's the term? I can't come up with the term right now. That's a shame. I'll write it down later on. But in other words, they didn't think it was medically necessary. And then I said, well, you know, I'm in pain. I've had this pain for about 6 months now. I've had this lump for years, but now it hurts and it's painful. And then she says, oh, well, that's different. Then they need to add 2 other codes that are related to a pain in breast. And I can't remember what the other one was. I said, so you're telling me if they add these other codes that then this would be totally covered? He says, yes. All he sent was something talking about a lump in breast. He didn't mention anything else. So I call the doctor's office. I give them this information and it passes. So now I can have the surgery totally covered. All I owed was a $50 copay. I was good with that. I was good with that. But the physician's office, this is a guy who's probably done a lot of these types of things, and he's probably had it denied a whole bunch of times, but I'm the first one who showed up who actually knew how this was supposed to work. And so it shows that physicians' offices, physicians in general, don't always understand how coding works. Actually, physicians who mainly work with hospitals have the exact same problem. I've been into a lot of discussions with medical records departments where physicians said certain things and I just started asking questions. Okay, but how is that this and whatever. And, you know, a lot of things have been recoded and changed up different than the physicians. But you know what? The physician's bill is going to get paid by a different level of insurance than the hospital bill. So hospitals have to make sure that everything is coded properly based on how hospitals code stuff. So if you're always listening to a physician who's doing the coding, you better get a second opinion. Or better yet, call their insurance company. If you think that something should be covered and your physician is telling you it's not, call the insurance company. Find a representative. Start asking questions. A lot of times you'll find out that they will give you a code and you will at least get some kind of reimbursement for that. And by the way, before you call, you need to know what code the physician is saying that something is. Don't just let them tell you, oh, we're going to do such and such, whatever. No, get a diagnosis code. If they have more than one, then use more than one. Anyway, that's what I have today. Like I said, I'm going to write down the word that I couldn't remember. This is the problem with getting older. But there you go. My name is Mitch Mitchell. Y'all have any questions, you let me know. And let me know your thoughts on something like this. I'll talk to y'all later.